As we're gradually moving back to opening schools and businesses and, of course, our in-person interactions, I want to remind you this is all time with cold and flu season getting going. Staying hydrated is key to helping your body deal with the added stress and with the upcoming flu season. My regular fans have heard me talk about a product called Hydrolyte for a long time now. It's an amazing rapid rehydration drink. It's a mix that, well, we're obsessed with here. I'm excited to announce they've just released Hydrolyte Plus Immunity just in time for cold and flu season. Hydrolyte Plus Immunity starts with their fast absorbing electrolytes and adds a host of immune boosting ingredients. Each single serve, easy pour drink mix contains 1,000 milligrams of vitamin C and 300 milligrams of elderberry extract, creates what is hopefully immune boosting formula that's high in antioxidants and zinc. Combining this with Hydrolyte's 7 key electrolytes, it's a fantastic way to stay proactive and properly hydrated. Hydrolyte Plus Immunity comes in convenient, easy to pour powder sticks that rapidly dissolve in water and make a great tasting drink that has 75% less sugar than your typical sports drink. It uses all natural flavors and it is gluten-free, dairy-free, caffeine-free, non-GMO, and it is vegan. And you can find Hydrolyte Plus by visiting hydrolyte.com/Dr. Drew. Again, that's HYDRALYTE.com/DRDRW. And be sure to use our code Dr. Drew 25 at checkout for a special discount.
Oops. That's supposed to be music playing, but hey everyone, it's a dose of Dr. Drew. Maybe I
Yes. What's that, Susan?
should I keep that at the beginning?
It's always kind of fun. But
I have
it's
to figure
'cause
out how to turn that off. Wait,
it's
hold on.
Happy, Happy, Joy, Joy is the name of that music.
Yes, yes. Today's a happy, happy, joy, joy day.
Is it?
Yeah.
Why?
I don't know. So I just want to also give a shout out to the people at Halodyne.
Yep.
You want to give a little?
Yeah, so Halodyne is this product. It's a nasal swab and a mouthwash. It's a povidone type solution. And it's one of those things, in addition to the IWAN, that I'm going to be doing differently in my life moving forward. If there's one thing we learned from this, infectious diseases are out there and happy to catch us. And when we fly particularly, I'm going to be using the nasal swab and the iodine, povidone
No,
mouthwash.
I'm going to be using it.
Well, you're going to use it because you got to not get the COVID. But I think we should all use it when we get on a plane for sure every time.
For the flu
And
or whatever.
for all all the different viruses and bacterial agents are out there that can get us. So I think it's just a nice hedge. We're learning that you can't eliminate spread of things, but you can reduce it. You can impact it, and this is definitely one of those ways. This was originally developed for doctors on the front line, and I spoke to the chemist. He's an ophthalmologist who developed it. He's a very smart dude, and I was persuaded by his product. So there's that.
Ooh,
And if you what's that?
Your nose is all stuffy.
It has been intermittently since this damn thing began. That's where the virus replicates. And if you are interested, you get using the code at checkout, Dr. Drew, you get 10% off. So
Yeah.
do use that. Hi, Joe Giannotti. Yes, Andrew Ashkazvili, I agree. Lisa's good. Now, Jojo Dean asked about, and Andrew, I want you to ring in on this, asked about spreading the virus in people with active immunity. So, like, I've had my Additic score, and we're going to bring a guy in later. We'll bring Sharuk back to talk about the Additic score. And so a nurse friends of Jojo Dean swears that you can transmit it even if you're immune. So the question is, can somebody harbor the virus in their nose, much like the way animals can harbor it but not get infected, and then transmit? The answer probably is the most honest answer. Andrew Ashkazvili, stick with me on this, and I want to hear your opinion as well. I think the most honest answer is we don't know. But I can't think of a single other infectious disease in biology that you can be immune to and measure the antibody, the neutralizing antibody response, and somehow transmit. There just does not exist in nature. Now, is this the first time in nature it might have happened? I guess it's possible. But and like I said, I'm going to continue wearing a mask anyway because people worry about these things. And that's fine. I will signal, make everybody comfortable. But I will continue to measure my immunity. And the point at which my immunity drops off, I will be getting the vaccine. So are we saying, and by the way, my immunity has been measured to be almost 15 times the average vaccine recipient. So you must also then say that every vaccine recipient can spread the disease. Well, that wasn't thoroughly ruled out in the studies that have been done so far. But to say that they do transmit is as dishonest as saying they categorically don't. But I don't know of any other situation in nature where that happens. Braden asked about Kevin Ryder.
That was really funny last night.
So I had him on my Fox 11 program last night.
We should have him on here.
Sure, you come on. He's not well yet. I'm a little ahead of him.
After all the years you did Kevin and Bean, it was good to hear you guys together. It was just really cool.
Yeah. And he had a febrile illness, did not measure his COVID antigens, but afterwards 3 times measured COVID antibodies. So he definitely was exposed to COVID, enough to be shown up on the antibody response. Now, I would argue it's a pretty good correlation. He turned negative in the summer, or like, I guess in the fall, winter time, and then definitely got COVID the second time. And it actually scared me enough to really, because the thought of getting this another time is just overwhelming. I swear to God. Yes, Joe Giannotti, I mean that interview. But I will be watching my immunity. I think there's 2 ways to approach it. You can do what Dr. Fauci said and get revaccinated or get vaccinated 3 months after you recover from COVID, or a more specific way, a more sophisticated way of dealing with it is this additive score, which I'm going to tell you about, where you can monitor your immunity and then take the vaccine when necessary. 2 reasons I want to do that. Well, 3. 1, I may have long-term immunity. That does happen. But SARS coronavirus 1, we've documented 15 years of immunity from that. 2, I don't want to take a vaccine from somebody who needs it. And number 3, I'll probably choose one of the later technologies, once there's a track record here. So why not let a little time go by and see how these vaccines are doing, and then pick one of the more, like the Novavax vaccine, which is one I'm kind of interested in, which is a more traditional attenuated virus. People are asking again what medication I took. Susan, do you want to post that?
You told me not to.
We had it on locals, right?
Yeah,
it's on
I put
locals.
It on locals, but you told me not to. We were going to put it on the website, but I told Caleb to talk to you because you didn't want to do that. So do you want him to put it on the website?
You can put it on the website as here's what I took. It's not what I'm recommending.
But what about the list that Joe put together for you?
That was the one I changed and gave to you. It
was sort of
Caleb.
like how to prevent, and then also what to take if you got COVID-19.
Okay, so
but it wasn't what you took. All of it.
I only did a thing that showed everything I took, essentially.
Okay. All right.
So D, where'd you go?
I'm going to put it on the website then.
Good.
Because I'm tired of saying it's on locals or it's here, and I can't put it here.
All right.
I mean, I could, but it's like a huge list. It's like, I'll find it.
Yeah. Okay. Andrew Ashkazvili is responding to my comment saying, Moderna and Pfizer are both saying immunity lasts at least 12 months from the vaccine. Why isn't natural immunity, which is broader and more intense by an order of magnitude, particularly in my case, why isn't that at least as good as that? And that is my point exactly. I'm not feeling a lot better, Tim. I'm feeling somewhat better. And D. Lori just tested positive. Vitamin C, vitamin E, zinc, quercetin, melatonin. Don't take steroids yet. If you're older, if you're above the age of 60, and if your disease develops into a moderate state, that's when the steroids, that's when the bamlanivimab can be of use there. Again, it's just me chatting with you guys today, so I'm looking at the thread. 53 with hypertension. Yeah, you are too young, GSR, for the bamlanivimab. You technically are. I do believe they will broaden that out one day because it is so effective. Yes, Frankie, the Johnson & Johnson may be one vaccine. We don't know yet for sure. I did not see that post on Locals, George. I'm sorry, but Susan, maybe you can look for that. For
Which one?
George Clark's post about a potential guest on Locals. What do I think we're done with COVID-19 if we... I'm not quite sure what that question is, Todd. All right. How accurate are rapid antibody tests? They are sort of notoriously inaccurate. We do sort of sign off on the rapid antigen test made by Abbott, but that is not an easy test to come by. Oh my goodness, Samantha's in the hospital with COVID, low oxygen. Yep, remdesivir and Decadron. That is so. If you're in the risk category, if you're hypoxemic and you're in the hospital, it's remdesivir and Decadron. There's some other stuff they can do after that. You might talk to your doctors about Regeneron. Sometimes they will use that in that setting. Sometimes, the stuff that Yo and I have talked about all this time, they'll use tocilizumab. Although when I read the literature on tocilizumab, I I don't know. I'm not
Sorry, I
sure.
don't mean to laugh. It just cracks
I'm
me
not
up.
completely sold on it, but leronlimab and what is it, FL100?
Bimolivimab.
These are all medications that do have some benefit.
Sorry.
I don't know the answer to that, MZ. I don't know the answer.
What's the question?
The vaccine is not being paid for by the hospitals that administer them. How can they create their own qualifications beyond the government decreed qualifications for who can get them, like saying who must be a patient of that hospital? And I will tell you that the hospitals are pushing these things through all kinds of ethics committees and coming out with very strange way. Thankfully, that's being overturned now by the CDC and some sane people, where they're saying everybody over 65 now gets this thing. Yes, RLF-100 aviptidil is another very important medication for people in the cytokine storm. So I got into the cytokine storm, right? Kenny, it's a great question. I think the smart thing is not to attend because of COVID, but I don't know how they're doing it. He wants to know whether you should be on a jury or not. When you're 70 and above, this thing has teeth. This thing will work on you pretty good, and not always, but you don't want to put yourself at risk for that. And something I've said on these threads before is, it's not just the mortality; it's the morbidity of this thing. And though the mortality might be 1 to 5% in your risk categories, the morbidity is like 20, 25%, and it's pretty nasty. Yes, I'm familiar with hillbilly elegy. Yeah, the first 48, I kind of agree with you. Or you don't have to tell them you can't lie to them on the jury form. You can't say you have COVID. Fluvoxamine, yeah. Fluvoxamine, again, it's hard to understand what that is doing and why it would prevent the cytokine storm, but there was some early data on Luvox or fluvoxamine being helpful. I did not take that medication. I think if you were 70 years old or so and sinking, you might think about that. That's for sure. Yes, you can take melatonin with other anti-anxiety medications. J&J results, early trials. Wait a minute, this is Andrew. Early trials released today found that trial members developed neutralizing antibodies against the virus by day 57, and 90% had them by day 29. Well, that's pretty crazy with one vaccine. So there's the J&J vaccine coming, and it looks good. David, you're asking a really interesting question. So David is asking, if you had mild COVID, does that mean you're having a weaker antibody response? And the best answer I can give you is we don't know. I'm kind of suspicious that there's a relationship between the intensity of the immune response and the seriousness of the illness. Now, is there a difference between mild and moderate and severe and really bad? I'm not sure. I don't think anybody's done that study yet. Hopefully, we can. What is this question, David, you're asking? LDL partakes in the immune system by adhering to... So is your question, there's no doubt in my mind that the lipid system is involved in the inflammatory component of this disease. We've had Dr. Shanahan on here before to talk about healthy fats and the relationship between unhealthy fats, polyunsaturated fats, and the potential for inflammation and cytokine activation. Now, when I was sick, the only thing I worried about was getting a clot, right? And the clots are not generated the way clots are normally formed with the activation of the clotting cascade. These tend to be something called nets, which are neutrophil clusters, very unusual, and they don't respond to any of the usual treatments. And that was actually, I was thinking to myself, that could be, I could see how that could happen given the relentlessness of the virus. And I worried about that a little bit. Why do I bring that up? I forget the original
Okay, I have
question.
a list of things to do.
Okay, hold on. I got to finish this
Okay,
thought.
go ahead.
My COVID brain is not allowing me to move from thought to thought.
Okay.
We've had Alex Berenson on a few times.
Maybe he'd come back. I don't know.
Hold on. Maybe it was about fluvoxamine. I was talking about lipids. And so I made sure during my illness that I did not stop my Vytorin. I thought about taking extra Vytorin actually, because, the pushing down, particularly the apolipoproteins and the oxidized LDLs, the very small LDL particles, can reduce the risk of, let's say, injury to the lining of the arteries, and thereby maybe reduce activation of a clot with the nets. So the lipid story has yet to be fully worked out for this illness, but I guarantee you it's a part of it. I guarantee it.
Okay, here's the list.
Whoa. Okay. There's the list. It's fully there on your screen.
Okay, take a screenshot
before it goes by.
Okay, this is after you get it, and then we also have how to avoid it.
We have low-risk patients, high-risk patients. Okay.
That's all the goodies.
What's EGCG? I don't know what that is. I don't even know what that is.
Where's that?
That's in there. Twice daily. EGCG twice daily for a minimum of 7 days. I don't know how that got into it.
What? What?
Just
what is that?
epigalactocalcit. I can't tell, but maybe Joe can help us
twice
with that.
Twice a day. EGCG. Oh well. I don't
know. Thank you, Rob.
Or ivermectin or.
So Nancy, the question: would Xarelto help against clotting? Yes, it would help, but it doesn't
green tea
help the way we expect it to, as much as it would normally do so. Oh, it's from green tea. Okay, green tea.
Okay, Joe.
Yeah, that's a well.
You
actually,
snuck it in there.
Yeah, you did sneak that in, but I actually am familiar with that data, and it is very interesting. That's in fact, I have green tea right here, right now, because
you said you were dreaming about it when you were sick.
Well, I don't remember that.
I wish I could have some green tea. I've been dreaming about it.
That's interesting.
So I got it for you.
But there are some stuff about green tea and the viral replication. So I get that. I get that green tea extract. Yep, very interesting.
So can I put this on the website so we can leave
it all. I sign off on that. I just didn't know what it was.
All right, I'm going to tell Caleb.
Andrew wants to know, is Phil Kerpen next? Susan?
I'm sorry?
Phil Kerpen, is he next?
No, you asked for that guy today.
Oh, well,
we have Dr. Porter tomorrow.
Okay, so tomorrow we're bringing an ER physician in here who caught my attention on Twitter. It was sounding
while
off.
You were sick. And then
she was sort of shooting her mouth off, and I thought, she has an interesting point of view. I want to talk to her. And again, I'm always talking to Kelly Victory. I'm going to talk to another ER doctor this way.
What's the guy's name you sent me today? Because Michelle got him for Tuesday.
He is a famous psychologist who, he is interested essentially in the massive cognitive dissonance that is operating today in the world, and he is sort of an expert in. Not so much cult. Oh my gosh, this dog is over here whining.
Here, I'll give her a cookie.
Not so much cult, but tribalism and all the stuff we always talk about, the psychology of today's world. He is an expert in that. He wrote, his name is like Shearman, Devil something is with the book. Not gonna come up with it.
We booked him faster than you could figure out what he does.
Well, he was on Fox 11 last night, and I told him we were going to call him.
Oh, okay. That guy. Okay.
Yes.
He's on for Tuesday.
Good. I just wanted to have a deeper conversation with him.
The other ER doc tomorrow, and then Friday you're taking
Michael Osterholm. I'm not sure we can get that, JH. It's hard. Anything else I should have been taking since I'm high risk? Again, we put it up on the board there. Maybe, Susan, you ought to run it again.
What's that?
What the high-risk prophylaxis should be for people.
Okay, I'll take the low risk off and make it shorter. Hold on.
Yeah. Well, do we have a low risk and high risk? Put the prophylaxis as opposed to once you're sick. That's what you do.
Oh, prophylaxis. Okay. Got it.
Hi, Wiz Chris. Hi, Anthony Brown. Hi, everybody. Thoughts on N-acetylcysteine? Yeah, I've seen the reports on that. Some people think it might have some benefit. I didn't take it. I had it. I got it, but I didn't take it. I feel like I'm taking enough stuff that I'm convinced about.
Here's a
prophylactic.
I can't say it. I need more coffee.
That's so funny. Now.
Well, I'm texting Caleb. I'm looking up your guest, and I'm trying to. I like your
we find it very charming.
I have ADD. Okay, everybody.
Relax.
Okay. I also have. I have selective hearing.
Thank you, Andrew, for
sending. I won't listen.
Thank you, Andrew, for sending those people over. We appreciate it. Andrew Brown, what's the study? Phase 1C, qualify the vaccine. 1C in California. Yes, hypertension does count. I would, in my mind, I mean, hypertension was what I have that really caused me to go do rather poorly with this illness. Is the melatonin for sleep aid known only? No, Jennifer. In COVID, people are taking it for its anti-inflammatory effects. 10 milligrams is sort of a super dose. Technically, for sleep, 1 or 2 milligrams is plenty. Oh, okay. Interesting. Thank you, Rory. Appreciate that.
What was it?
He's
Yeah,
saying
just-
this is saying that. Well, I don't want to repeat it.
Oh,
There's reasons I don't repeat some of the things I don't repeat.
okay. Well, I'm just listening. I'm not watching what he said.
Glutathione. I think it's a reasonable thing to use. Glutathione is reasonable. I did not take it, but I think it's a reasonable thing if you following guidelines.
Frank says he loves me more than you.
That's probably true. Why not?
His name is Frankie Strychnine.
All right, I'm sort of out of it right now. I got to say, Susan,
Sorry.
I'm having trouble functioning a little bit. Do I think I would have been hospitalized if I used aspirin or common drug to treat yourself? Todd, there is no doubt in my mind, if I had not used dexamethasone and the monoclonal antibody bamlanivimab, I would have been hospitalized. No doubt in my mind.
So crazy.
And so,
but then our son just pranced right through it in 4 days.
Yeah.
Isn't that weird?
Yeah. Well, this is one of the things that the public health officials did poorly, was helping people understand the stratification of risk. If you're young, this is a flu. If you are old, it's a flu followed by an inflammatory disease that is very dangerous and progressive.
So do you want Casey to come on?
Sure, if you'd like to.
Right.
Jerry, my view on masks is I wear it religiously. What are you talking about? Oh, I see. You mean it's that I feel you can get it even with the mask on? Of course you can get it even with the mask on. I want to mitigate risk. I want to help everybody feel uncomfortable. I wear the mask. And even though I'm immune, I will continue to wear the mask. I don't think that's very smart, but that's how people want me to be. I'll be that way. That's fine. Another cohort study on fluvoxamine, 100 milligrams TID, which is a lot, finds zero progression to moderate COVID amongst a cohort of mild COVID. That's interesting, Trevor. Andrew Ashkazvili, get that study to Dr. Yo if we can. This is a prospective study, fluvoxamine 100 TID from @boolware_dr. Zero progression to moderate. I wish I'd known that before, because I was taking everything I get my hands on. I would have taken that. Although fluvoxamine is a pretty powerful psychotropic medication. So it's, all right. If you say so, Anarchy. The mic is distorting.
I know. It's weird. I don't know why it's doing that.
Usually I need to hold the mic right at my.
It's weird.
But
I know they're both like vacillating. It pisses me off. I don't know why it does that.
All right, so Vince is asking the thing we've been talking about repeatedly today in this thread, which is, can you carry the virus after you recover from COVID? And the answer is you can't contract it until your antibodies and cellular immunity drops. Then you can get a second experience. Kevin from Kevin and Bean had it, and I'm convinced that's what he had, and it was very dramatic fashion too. He was really sick the second time, and
I think it's time to get
because of his experience, I'm convinced that people should be revaccinated. Dr. Fauci has said revaccinate at 3 months. I'm thinking of revaccinate myself after I monitor my immunity with an analytic score and seeing where it goes. And then I will, when it starts to drop, that's when I'll take the vaccine. My antibody levels were against multiple viral proteins, not just the spike protein, which is what the vaccine is directed to. But on my spike protein antibodies, the average vaccine recipient was about 15,000 level. I was over 150,000. So I had this massive immune response, which is maybe why I got so sick. Who knows? We don't know that yet. Yeah, Misty, I'm looking for those number on overdoses. I have not seen them yet. I just looked them up before the show started. The only thing I found was 2018 data, which was a little surprising. My understanding is this is going to be current data. J. Mick, you asked this question yesterday. I answered it yesterday. I'll answer it again today. You were told not to take your prednisone for 3 weeks. That is because it suppresses the immune response from the vaccine. Alcohol is also associated with a suboptimal immune response. Talk to your doctor about the prednisone. You can't stop prednisone suddenly. You need to talk to them about what you should be doing. Please keep in mind bad fentanyl OD this year. Yeah, it was a bad year for fentanyl. Absolutely, I know that to be true. I've seen some preliminary data, And I'm hearing that it's going to be rather striking, the overdose data, which makes perfect sense to me given what's been going on in this country. It's just beyond. So are we going to talk
Hold on,
to
I'm getting
Casey
it.
here?
I'm doing it.
I'm looking at the current
876.
I'm just looking at the current journal. The American Medical Association just came out. Not much very risk factors for all-cause mortality in nursing home residents with COVID-19. Not much in that particular publication. In the New England Journal of Medicine, I've got that just out. And let's see. There's a lot of vaccine stuff on there. Convalescent, interesting. Convalescent plasma antibody levels and risk of death from COVID-19. So this is getting at that question we were asking a little earlier. And conclusions, mechanical ventilation, this is whether or not it worked, plasma transfusion, lower risk of death in those on ventilators. So there's a piece of data for high level plasma transfusion, which Susan, I really want to do.
You want to talk to those plasma people?
I need
now?
to give plasma, absolutely. Once I'm feeling better.
All right, I have the PR person said they'd give it to you for free, but you said no when I asked you.
I want to give plasma for other people.
Oh,
Yeah.
okay. I thought you wanted to get the plasma.
No. I'm going to give plasma. I have lots of antibodies. High titer antibodies are the ones that are thought to be most efficacious, and that is me. Okay. DJ, go to Additics website. People have been complaining they don't know quite how to order the score off of there. I told the people at Additics they had to make sure that they have, show how to sign up and how to do it. I don't know if they're ready for that yet. They're sort of ramping up. So negative Sunday, symptoms Monday, tested positive Monday night. D. Lori, I didn't test positive for the first 4 days. Hey, Joe, how's Leopold doing?
Yeah.
Had kids all weekend. How possible is you transmitted? It's highly likely, right? Although, my first 4 days when I was negative, I was around a lot of people and I didn't transmit to anybody. All my contacts have been checked and none of them have contracted it. The only person that got it was my son, and we're not sure if it was in that first 4 day window or was the fact that he
What about Bert Kreischer? You were sitting with him on Christmas Eve, right?
Yeah. No, the day before.
Day before.
Yep.
Well, you were sitting with me too.
It's Additics Score, Jason. Additics Score. The website Additics.
I didn't get it.
Yeah, Susan didn't get it for me in spite of being with me all night the night that I developed the fever.
2 days.
Yeah, but the
fever.
Well,
the whole week I'm always with you.
Yeah, but you especially were there while the illness started.
Yeah, but you weren't shedding the virus on Christmas when you had the fever. So.
Jeremy's asking, will I have any muscle or nerve pain? I have weird numbness and tingling. And I do occasionally get some weird upper back pain. There was terrible lower back pain when I was in the midst of the first part of the disease. How do you know I didn't get it from my son? He has not left this environment. Do you think Jordan could have given it to me, Susan?
No, because he's been in quarantine for a year in the pool house.
Yeah, but
he has not even left the house except for to go to Whole Foods. He didn't give it to you. You got it at the hospital.
Joe, thanks for that update. I appreciate it. Sounds like he's doing great.
All right, we have a
Casey.
Well, Casey has been sick this week, and he's very stoic about it.
All right, is he on the line?
Hold on. Let me get him.
Do I need to go on the system, a different system or anything?
Relax. I'm getting
Amy, ivermectin internationally is used widely to great effect. The World Health Organization has come out very strongly in favor of it. There's lots of good publications showing it works. I took it. I would tell you to talk to your doctor about it. I think I would have taken more in retrospect than I took. I took it for day 1 and day 3. You can also take it at 5 days in a row. I wish I had actually done that.
I don't have a video, Casey.
Do we have a phone?
Is he on the phone or?
How are the hospitals doing in LA County? Well, if you listen, Frankie Strychnine, if you listen to Justin yesterday, he was telling us that the COVID-like illnesses had dropped dramatically, which is a early indicator of the surge ending. So the CLI is way down, and if you look at the graphs, I'll maybe show them to you after we talk to Casey. Carol McDermott, we just gave an update on Leopold. He's walking, he's in good spirits, he's tired, which is, I understand. That's certainly me.
Hi, Casey.
There you are.
Hi, guys.
So what's going on?
So, well, as soon as you guys make me laugh, I'm going to start coughing. So I don't know if I have COVID or not. I got it last year. So I've been,
Oh God.
I'll let you finish.
Go ahead.
So yeah, I just had this cough that started coming on. It got really, really bad. You guys started getting concerned. So I contacted the VA. I did everything that they wanted me to do. I got tested this morning. I got to wait 3 to 7 days before I get my results.
That is crazy.
They're not worried about you. Let's put it that way.
I'm not worried about me either. But now my life is, completely on hold.
Because you're on quarantine.
Pretty much, yeah. I can't do anything until I have an answer.
Yeah,
Right.
I understand.
See, this is why we need the over-the-counter instant test, or whatever you call it, the rapid test.
Well, Susan, I actually looked into doing that as well, and everybody, the test is $100, and 2, I didn't find anything that had more than 1 star.
No, but I mean like the rapid test that you just do yourself. They're little cards, the Abbott tests, but they're not available. They're not, that should be available to the general public.
So you're talking about something completely different than what I'm looking at.
Rapid test, not the PR.
Not the PCR.
PCR.
Oh,
You're
okay.
talking about the Abbott rapid test.
Yeah, that's what we used, and that's how we found Jordan had it.
Interesting.
Yeah.
I would love it if I have COVID again. I would love it.
Why?
Well, because one, the first time around, I made it A-okay. We didn't even know about COVID back then.
Right.
And then now the second time around, I'm looking at my temperature, all this other stuff. Not only did I not get a temperature, I actually went down. I was 96 degrees the other night.
So even if this does end up being COVID, you would be in the mild category. And
yes, sir.
And even, you could argue, and you might want to talk
But you were out yesterday without a mask. You might have given it to 5 people.
No. So now here's another thing too, is when I was out and about, I told everybody, I got a cough, I've got a mask. Do you want me to wear a mask? Nah, don't worry about it. I went to the tire shop, to the ER. Yeah. And everybody's like, nah, we're not worried about this anymore.
Sounds like my dad.
Ralph, there are only hand people that have gotten it twice, but we're seeing it more frequently in well-documented situations. So what I'm saying is the fact that it's possible to get it twice, once you've had it, the thought of getting it a second time is enough to give you PTSD. So that's why I'm monitoring that very carefully. I do not want it a second time. Why did COVID make people's face red? I've not noticed that. The steroids make people's face red.
Well, maybe that's why your face is red.
They're asking where you live.
Face is red. Yeah,
They're asking where you live, Casey.
Oh, I'm in Santa Barbara, California.
His face is red for other reasons.
Not yet.
Your face is kind of red.
Yeah, it is. I feel flush. Yeah, I don't know
bet
why.
You have it. I know you have
Maybe.
it. Because I don't know, but you're gonna have to quarantine. I hate to tell you.
I know. Oh well. So I'm stuck here.
I don't mean to
to you
be
guys.
a meanie, but I think it's important for other people. That Santa Barbara's safe.
Yes, ma'am. Yes, ma'am.
He listens to me.
Well,
I do.
I cursed him out the other night because he couldn't breathe. He was coughing so badly. I said, take, an inhaler and clear your nose.
Right. I mean, do you have a physician? Do you have any?
Yeah. Well, I was at the VA this morning, and because I've had lung issues in the past, the Symbicort is actually really slowing down the coughing.
Good. Okay, good.
Yeah.
And Symbicort is similar to the budesonide that people use for COVID too. So.
And don't forget to stay hydrated, right? And what do we do for that?
Hydrolyte.
Hydrolyte.
Does herd immunity exist as a thing? Joe wants to know. It does, but whether we'll ever get there is a whole question mark. People don't know yet because the virus may change a little bit. The virus's job is to stay alive, right? Our job is to put it down. In the future, we likely to be offered flu injections and COVID vaccines. Yes, that's possibly true. We'll be maybe updated vaccines every year. Who knows? We'll see. Could COVID cause a positive heterophile test? I don't know the answer to that. I doubt it, but I don't know. Well, let's go, Casey. You're just going to sit at home until you get that result and cool out?
Well, I mean, I was actually thinking about paying out of pocket and going somewhere else and trying to get a rapid test.
Yeah.
At this point, I really don't know what to do. But I mean, I feel great. I'm
Okay,
okay.
I mean, the only thing a negative test would afford you is the ability to move about. And how long have you been sick now?
About a week.
Yeah. So you should be positive if you're going to be positive.
Right.
Well, so I have a story we haven't told yet.
Oh.
So when Drew got sick, my son wanted to go to Vegas with his girlfriend, and we had the Walgreens test. So he sent the Walgreens test in overnight, and it came back positive under my name because Drew had signed the box up for me. So anyways, we got the rapid test from an undisclosed person, and we all rushed and took it the next morning, and Douglas, who had the positive test, was negative, and then Jordan was positive. So I talked to Walgreens and I said, listen, my son tested positive. And he didn't go to Vegas after all. He stayed home the whole week. He felt fine. He hadn't been sick or anything. So there is a possibility that you can get a false positive from I don't test that. I don't really trust that now. I mean, it clearly didn't work for us. And I spoke to them, and she said, well, the PRC, is it PRC? Is a lot more sensitive than the rapid test. And I said, yeah, but he has no symptoms. He's fine. And, his girlfriend doesn't have it either. So I don't know. I don't know what to tell you. I agree with you. It's probably better to get the more evasive test from your doctor because there's a better chance that you'll know for sure if you have it. And you won't just be another statistic.
Well, here's another thing, though. I've heard Drew talk about this with the PRC test, which is you can test positive forever.
Right. And that's...
Which isn't true because Drew took
that's
test.
That's not a PCR.
Oh.
So when that's one of the things concerns me when we go to New York, they're going to do PCR testing. I could still be positive. And I don't know
we need
what
to
they're
get
going to do
a
with
serum
that.
test from our doctor in advance.
An antibody test. No, I'll do an additive score right before I leave.
Yeah, me too.
All right.
Okay.
And for the rest of us, all we have to do is just donate blood, right?
Yes.
If you want to know your antibodies. Yeah.
Yes.
Well,
Joe, yes, I'll be on Fox 11 this evening.
Isn't it crazy though? Like he had COVID-19. It's clear, and they still want him to take a test before we go to New York to see if he has COVID.
No, Rain, he's not asymptomatic. He remained negative. He had one positive and then multiple negatives, and so within hours. And so I don't think that would be called the asymptomatic carrier. I don't know. Maybe. I guess.
Barbara Barrera said her body hurts from head to toe and she has diarrhea. Good chance you have COVID because you get this horrible headache.
Headache, and the freezing is the temperature going up. That's the chills and stuff that comes
take
with this.
some Tylenol.
But Barbara, what age are you? What kind of what zone are you in with this thing?
I mean, it's all out there and everybody's getting it, even Casey. And
Well, it's turning
down. Well, now,
go ahead.
I'm sorry, just real quick. It's what's interesting with me is this whole second time around. Even though it felt exactly the same, my lungs itched. Drew, that was one of the questions I had for you is, do you have itchy lungs? I had all of that. Lungs. Okay, so I call it itchy.
Yeah.
But it was. Well, I mean, it sounds like you're struggling to breathe right now.
Me?
Yeah.
I am a little short of breath. Yeah. Yesterday I was really short of breath.
Yeah, I can tell. I can actually hear it. That's
COVID. That's what it does.
Yeah.
But for me, I mean, and that's why I'm convinced that honestly, I know the test is going to come back positive. I'll be surprised if it doesn't, because it felt exactly the same.
Clinically, you really are just bronchitis at this point. And you're entitled to get bronchitis. It still happens, believe me.
Oh yeah, I get it all the time.
Yeah, so I don't know. We'll see what it shows. Susan, would you put up the data for let's see, United States from COVID tracking? There
Bing.
It is.
Look at
that. Go scroll up a little bit. The death rates are still climbing, which is terrible. The hospitalization rates are plateauing, but with a positive slope.
This is 90 days.
Yeah, go up further. But the cases are kind of spiking and maybe turning. I mean, things when they turn kind of get spiky like that. So we'll see. Again, that COVID-like illnesses are on the decline, and the Justin,
A lot of people in the hospital.
I know, who we spoke to yesterday, felt that was really a thing. Now put up California. California has been the hot spot. Somebody asked a great question: why is the West so bad? And here's the answer: we don't know. But guess what? Texas, Arizona, California, it doesn't matter what their state of lockdown was, it all behaved the same on the same time frame, essentially, which is kind of interesting.
You want the historical or 90 days?
Just like you got it. And scroll up a little bit to the hospital. Okay, so you can see the hospitalizations are plateauing a little better than the national data. And again, it's turning down, but whether it's going to stay down, it's sort of a plateau up there. It's a lot of people. And unfortunately, the death rate is still positive.
548 today. Oh God, Barbara Fur is gonna have fun with that.
Well, that's the California one data. But again, I think it's the same question I asked Justin yesterday. What's a lot? They were telling us it was a lot when they were 10 deaths a day, and now they're 500 deaths a day. What's a lot? Or is 1,000? Are we going to 1,000? What's a lot?
So that's one every 5 minutes now instead of one every 8 minutes.
Yeah. Well, that's California. That's not the county so much.
I hate it when they tell people that. It just sounds. One person every 8 minutes.
It's just
They used to do that with drug addiction or cancer. They used to say that all the time.
Exactly. That's not how you change people's behavior. It's not how you get them to cooperate. It's the opposite of how you get them to cooperate. I don't know, Joe. We thought we had a massive wave, but again, that's the question. We're such a huge state with such a huge population. How big is big in a state like this? How big is massive? Yes, they had a big wave in the summer, true. No, Samantha, there's no evidence of that I know of. It's more questions of seasonality and that kind of thing.
Drew,
yeah.
Drew, real quick question. I'm sorry. Yeah, do it,
bless
dude.
you. Oh, bless you.
Yeah,
It's
clear it
a little
out,
dusty
clear it
in
out,
here.
baby, clear it
It's
out.
dusty in here.
Go ahead.
So my question is, though, I mean, there's already been so many questions about the numbers in the first place. How do we even trust what we're being told?
Right.
Well, I understand. I'm relying on the numbers that I can get access to. Somebody said there was some panic porn about the number of deaths in the country. I'm sure it was high. We are at we were at 4,000 yesterday. So if we were at 4,400 today, that would not be surprising. That's within range, within striking distance for sure.
Well, I'm now a statistic, and I've had COVID-19, even though I didn't. So the test was good.
Right.
There you go. Well, I mean,
But now I have proof I've had it.
Okay, Hody, is that your name? You guys should listen to the interview we did yesterday about data, because with Justin, what's Justin's last name, Susan? I blocked out.
Justin Hart.
Justin Hart.
Shoot, I took his banner
We
down.
talked all about excess deaths. We talked all about cancer and heart disease and other illnesses, and so you can get that data there. People are trying to talk about data here. That's not the topic for today. That was with Justin Hart. Well, Casey, let us know what it turns out to be.
You sound much better
Yeah, you
today.
look good. It's at least going to be mild disease if you get it.
Yeah, thank God for that, right?
Yeah.
Oh, totally.
And hopefully you're drinking your Hydrolyte.
Oh, absolutely. I snorted.
Right.
Drew
know,
loves it
you
when I say
snort
that.
Anyways,
It's my joke.
Casey is a member of Locals. Join the Dr. Drew community at drdrew.com/locals, and you can keep up with Sir Casey and his crew. He's over there.
And I'll join. We jump in once in a while too, so we'll see you guys.
Oh, absolutely, yeah.
All right,
we have
Casey,
Zoom
thanks
shows, all that good stuff.
Thanks for dropping in. Let's keep us posted. And Kim Bouts,
God bless.
go to Additics website, and I don't know how to sign up there. I've asked them to make it easier for people that are interested. I don't know if they're ramped up to take the general public yet. Juan is asking my take on ivermectin. We've already addressed that twice today. I took ivermectin on day 1 and day 3. I wish I'd taken it day 1 through 5. The World Health Organization has come out strongly in favor of it, and the international use and data on COVID on ivermectin looks very, very, very good. And Trevor, I think fluvoxamine would be a great idea to talk with Dr. Yo about that. Maybe we bring Dr. Yo back in for an update.
I want to get him with the guy from the Bama Limbalam people, the Coram people.
Oh, really?
He was working on getting them to come on.
Okay. Great.
But, you know, it's been a weird week. You know, chasing my tail and trying to catch up.
All right. Excellent. I'm really, for some reason, you know, I know the reason. I'm tired. I've got COVID, and I can only go for a little period of time before I just lose it. So I'm gonna have to go lay down for a while. If there's any last minute questions here, now is the time to get them on here.
And we really appreciate the support everybody's given us, and share this if you care, and, you know, get more information out to everybody. We're doing our best to keep Drew propped up and keep the information coming.
Anthony Brown, do you want to be on the thread here? Is that what you're saying, or do you want me to in person or call you? I need some clarification when you're talking about Anthony Brown.
Who? Oh, Brown.
What
did he say?
He wants to talk about some stuff. And I don't know if he wants to talk in person or on the phone or on this thread.
I assume he wants to. He wants to be on the.
Jeremy, what do I think is causing my brain fog? It's the virus infects your brain. Make no mistake about it. You can tell. And you're also hypoxemic, and that affects your brain. It's like getting a major head injury.
Casey, email Anthony the link for the Zoom.
And Kelly Gallagher, I've not heard about that story you just put up here in the post. I'm sorry. I never heard of it. That's terrible. Okay, so
do you want to talk to Anthony?
If he wants to come in, does he want to come in now? I'm not. I'm not sure that's what he wants to do.
He wants to. Well, I can't tell you.
Early info about what to do for testing if you suspect you have COVID. Once you're sick, it's too late. I'm not quite sure what you mean by that, because I did not get tested until I got sick. And once I got sick, I was negative for the first 4 days. And I was relieved to hear that I was positive, because I started thinking that the only thing that causes this kind of illness is leukemia. And that was the only time I had a little bit of fear with this illness. Yeah, Barbara, it is a horrible feeling, isn't it? Just an awful feeling. Susan, are we going to do something here with Anthony or no?
I'm asking him.
Sorry, guys, I'm working on it right now.
I don't know what he wants necessarily, or if he does want to talk on the thread here. Disneyland not being able to open, but will be used as mass vaccination.
Hooray! Those parking lots come in handy.
Yeah, and Andrew, the fact the surrounding businesses, and I just think of that as the poster children for how horrible our government has been to the population, and these people's lives were ruined, their businesses were ruined. California at least ought to take a page from Governor Cuomo in New York, who has finally taken the position that if he doesn't open up, there won't be anything to open up. And he is absolutely right about that. Barbara, I've been sick for 3 weeks. 3 weeks.
Since Christmas.
Yeah, Christmas Eve is when I get it. I will be back at your mom's house next week. I thought I was going to make it this week, but no.
He didn't respond, so maybe he...
Okay.
Can we chat on a thread, or I can call you and discuss my point? Anthony, look at your email. Casey just sent you the link.
That's funny. Yes, Midnight Toker, people with allergies to vaccines should be careful with the vaccine. If you're a highly allergic person, you also or somebody should be being careful, because they are prepared for that. They have epinephrine, Benadryl, and steroids on hand there. Novavax versus messenger RNA for long haulers. ZZ, I'm not sure. So you're wondering whether it depends on your immune response, right? If you have an adequate immune response, you don't need any vaccine. But if you have a choice, I think the Novavax might be the best choice for you. The question is whether or not some of your long hauler symptoms could be mitigated with a vaccine, which is a really interesting question that no one has any data on, to my knowledge, just yet. Oh, Barbara's asking which is better, COVID-19 or death. I know you're not trying to be funny. I literally thought if I got it again, I'd jump off a building. So,
well, no, you
DJ, ivermectin as prophylaxis. I had Susan take ivermectin as prophylaxis.
And it was hard on the stomach.
Hard on her stomach, so she stopped. So there you go.
All right, here we go. We got some Anthony here.
All right, Anthony Brown. We just have your audio, I think.
Yeah, and let me see.
Hold on.
Anthony. Oh, where'd he go?
Zoe, yes, your mom should get the vaccine. CLL is very different than ALL, which is what I was thinking I had. Anthony, what's going on?
Hey, how are you?
I've been better, but, I'm here.
Okay, yeah, I just wanted to tell you some of the stuff that we discovered. We vaccinated 262 people.
Okay, tell me.
And here, let me turn down my volume on this thing.
Yeah, we don't want it to reverb. Okay. My sound guy
I
said,
love being at work.
"Oh, those sounds coming around." I'm like, "Yeah, somebody left their volume too high. You got to turn your volume down when you're on a restream or on a
Okay,
Alrighty.
yeah. So one of the things we did, what we're doing now is we're doing rapid testing on people who've already got vaccinated.
Okay.
And what we're seeing is no one is showing positive. So the Pfizer vaccine thus far is not showing positive on a rapid test.
Pfizer vaccine is not showing positive for COVID. But you're doing a rapid antigen, not a rapid antibody test.
Right. And
Okay.
we're following it up with a PCR, and we'll have that information probably by the end of the week.
All right, that makes some sense to me. The PCR will probably be positive, but the viral particles may not be sufficient to show up on a rapid antigen test. That kind of makes sense to me.
Right. And so we're doing that. And one thing that we have done too is we've, at our doctor's order, we gave people vaccines anywhere after 14 days of testing positive, as long as they didn't have symptoms.
So
And
you gave the
now-
vaccine to the recovering population as well.
Exactly.
Okay.
And
Which,
so
again,
we're watching.
it's interesting in that you're not measuring the immunity, so you don't know who has a robust immune response. You're in an environment with lots of virus, and you don't want any people to get it a second time if there's any possibility of that. So that kind of makes sense to me.
Yeah, and so that's fascinating. And then we have those that slip through the system who we tested negative, gave them a vaccine, and then their lab results came back from a close date and they were positive. So we basically gave somebody positive a COVID vaccine. So we're looking at to see the results of that as well.
So the PCR with the send away are turning positive. Yeah, that makes sense, right? So the rapids are going to probably negative. The send away will be positive. The antibody should be positive if you measure that. And interesting. It's interesting. You have to improvise. How's your infection control nurse doing?
She's out now.
With COVID?
She is?
Unfortunately, yes.
Oh, brutal.
How come?
She's sick.
And she said, yeah.
She's tested. And so it's interesting the improvisation that's going on, right? So Fauci says 30 days after the illness, you should be revaccinated. I say good. I'm also saying you can also, if you're inclined, check your immune function and then follow that as the guideline for revaccination. But in a high viral environment, it makes perfect sense to me that you would just vaccine pretty quickly, right after recovery.
Vaccinate.
That makes some sense to me. Yeah. Oh my goodness.
Yeah. So I just wanted to share that with you.
Thank you for that. I appreciate it. Is it settling down there?
Yes. We haven't had a positive in the past 2 days.
Wow.
Good.
And are people
Except
coming?
for the nurse?
Even the nurses, the past 2 days, nobody.
No, I mean your
It was
infectious
more than
person.
It's more than 2 days ago she converted.
Oh, okay.
Yes. Yeah.
And are the patients coming back? You said some of them were being hauled off by their families and things.
The ones that went off with their family aren't coming back because we're still closed for admissions.
Oh, interesting. Do you think that could end up being a net positive? In other words, they can arrange more outpatient services in the home for those patients?
I would really hope so. It's just sad because the way the whole vaccine system is, the people at home are further down on the scale than those that are here in the hospital.
Further down the psych functioning scale?
No, as far as vaccination, because we're technically 1A.
Less likely to get the vaccine. No, I understand.
Right.
But no, my question was, do you think the motivation to bring them home might motivate people to organize assisted outpatient treatment or something that can help keep them in the home?
That would be nice. That would be a good thing. And maybe when they call us to ask any latest information from their doctor, maybe we can educate them a little bit better on trying to keep them at home.
Right. Exactly. So So there could be a net positive and save you guys some beds for more sick populations. Interesting.
Right. Absolutely.
Interesting.
Yeah.
So I'm also being told, I don't know if you've seen this data yet, that we're going to have some overdose deaths data coming out sometime today. Have you seen anything about that?
I haven't seen it, but I know that it's out there because out in the homeless community, they're not collecting very much data out there. But I'm sure that there is. I know there's increased use that I've seen, but as far as death and things like that, I haven't seen.
It's most of it's fentanyl, of course, and so there you go. Well, interesting. You're staying well?
Yes, I'm doing good. Thus far, I've got the vaccine. Nothing's going on, just working and doing what I do.
Good, man. Good to talk to you. Thank you, Anthony. Thank you, Casey. I'm going to have to wrap up today because I am, I'm tired. So Cody's sending good vibes to Susan.
Thank you. They all want to know how many BJs you're getting
Yeah.
out of COVID Symphony.
Yeah.
Okay, bye. Thank
Bye,
you.
Anthony. You have to go to your mom's house to
There's a
figure that.
nice little chat back here
You have to go to
in
your
the
mom's
backdrop. I know. It's like we're talking about serious medical stuff.
Go to your mom's house. Go to your mom's house.
Everybody wants to
You
know.
do not want, if you're over 65 and they've hit 1B tier 1 in your area at age 65 and above, you can go get the vaccine without a doctor's order. All right. When I hit the wall, I really hit the wall. Okay.
Okay, baby doll.
So we are going to wrap this up, and we'll see you tomorrow. Is that correct, Susan?
I like the music there in the background.
Yeah, I like it
It's
too.
your outro.
I like it. And tomorrow we will have that ER doctor.
Dr. Blah, 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 Porter.
Porter.
Emily
Okay.
Porter. She also is a sex doctor.
She
Do
is?
you know that?
I did not know that.
Oh, wait till you
I know,
hear about her.
I know her sister, I think, is a congressman or something.
She is a board-certified emergency physician
I
with
know
over
that.
12 years of experience.
I know that.
But she also is known as a love doctor.
Interesting. All right, good for
She's
her.
in Austin, and she's actually very pretty, and good find.
Good.
You found this in
Well,
a COVID
I was
haze.
in a COVID haze, and she tweeted about allowing doctors to get sick or die, and how much investment of time and training is being lost, as well as manpower to treat the sick people if they allow that to happen. I was lying there as one of those pieces of data, and I thought she's onto something, and I want to talk to her about that. So there you go.
Yeah, and then we're gonna also have. I didn't pull up her banner. I should probably get that while I get her banner.
You want to just put her picture up there?
Yeah, I have the banner.
Okay.
I just haven't. I didn't put it up. Sorry. Probably a good idea.
Okay. Vinny Tortorich wants to come on the thread.
Is he here?
He just sent me an email.
On the thread right now?
No. Eventually.
Oh, on the show.
On the show, yeah.
And talk about
how safe is the gym after getting both doses of vaccine? You're 95% coverage, Brian. It should be great. Should be great. We gotta get people back living and not behaving like primitive man, and get off the hysteria and the delusion we talked about a few days ago with that psychiatrist.
There she is, Emily Porter.
There's Emily Porter. Okay, that's who we're going to talk to tomorrow.
Michelle had a nice long talk with her and said she really enjoyed her time with her.
Great. So it's a good find, and we'll have a conversation.
Her new best friend.
Ashley wants to know if we're moving to Texas, Susan.
No. We're fine here. We have. I'm remodeling my porch. I'm going to live here for a while.
All right.
So we can sit outside for the next pandemic.
Yeah, for the next oh my gosh.
And then also, thanks to all our sponsors. We really appreciate it. It's really nice to have some kind of income during this pandemic.
Well, there's that, and these are actually things I'm going to be doing, which is I use a UVC light with the iWand. I use Halodyne when I fly and travel. That's this to get infectious diseases off the respiratory tract. And Hydrolyte a couple of nights saved my life. So there you go.
It's true. And also a little shout out to anybody who's been supportive in Drew's Cameo career. It's been very fruitful in the last year, and I appreciate everybody who's, but Valentine's Day is coming up, and you never know, it might be kind of a cute thing to Get a Dr. Drew cameo.
All right. Let's head for the exit here, Susan, so I can lie down.
But you asked me if there was anything
I did, and I appreciate it. But now I got to go. I'll see you tomorrow with Dr. Emily Porter.
Love you guys. Oh, bye. Bye, Casey.
I am so grateful for our friends at Blue Microphones. Not only have they completely changed what our show sounds like, they've given me headphones so I can monitor things better. This is the mic for millions of creative people, and now I know why. I'm so grateful for them completely changing the quality of our audio. You'll find Blue mics like Yeti and the Mouse, which we're using here, both in pro studios and home studios, literally all over the world. Their popular Yeti caster is a Blue Yeti microphone, plus a boom arm system that's behind many of your favorite podcasts. I run into them all the time, and now I know why. If you've ever thought about creating your own podcast or YouTube channel, Blue can make you sound and look great. Just visit bluemic.com and click Get Started, and you can start telling your story.